Good afternoon or good morning to all of you, depending on where you are. I want to say thanks for joining our briefing today for Dangerous by Design 2021, a new report from Smart Growth America and the National Complete Streets Coalition about the epidemic of preventable pedestrian deaths on our roads that are designed for speed instead of safety. My name is Steve Davis. I'm the Communications Director for Smart Growth America. If you need me today, I can be reached at any time with questions or concerns by email at sdavis@smartgrowthamerica.org. If you've got any questions about the platform or technology, you can ask a question through the chat function. We have staff there to answer questions as we go. I want to note today's session's being recorded. We'll provide a recording of the briefing today as soon as we can after we wrap this afternoon, hopefully, and we will have a transcript with captions available in the recording. We are also providing closed captioning today, live captions. But to access it, you will need to click a link that's being dropped into the chat, hopefully right about now, that will open a second window where the transcript will run there. We'll drop that link in there a few times for people today. We hope to be taking some questions at the end of our session today. We're kind of jam-packed. Hope we have enough time to take some questions. You can drop those into the question box. Some we may be able to answer even as we go. And before we get started, I wanted to thank especially the two groups that sponsored this year's Dangerous by Design report, Nelson Nygaard Consulting. Thank you deeply very much for your help with this, and the Centers for Disease Control and Prevention through their Active People, Healthy Nation initiative. And we have Ken Rose from CDC on as one of our guests today, and he'll tell us more about Active People, Healthy Nation. We're deeply grateful to Nelson Nygaard and CDC for sponsoring this year's report. And I do want to give a special thanks to Amy Cohen and Families for Safe Streets for their help in some of the behind the scenes with the briefing and getting us connected with some of the people we're going to hear from today. So I want to just walk through real quick what we're going to go through today. The speakers that we have Beth Osborne, who is the Vice President of Transportation at Smart Growth America. Ken Rose, as I mentioned, works with the CDC. Rayla Bellis is our report author at Smart Growth America. She's going to walk through some of the findings in detail. And then we're going to hear from a couple people at the local level. Latanya Byrd lives in Philadelphia. Her niece and three of her niece's three children were killed on a road there 8 years ago. And then we're going to hear from Scott Crawford and Gladys Bunzy, who are advocates from Jackson, Mississippi, with a story to tell. So we will be tackling questions today. As I mentioned, you can drop them in the chat box during the presentation. We'll answer some as we go, ask them at the end. If we have any members of the media today that have joined, feel free to arrange interviews with the two email addresses on the screen, myself there, and Valerie Holford. We can set up interviews with Beth or any of our panelists and answer some of those questions there. So I do want to say a big thank you to Secretary of Transportation Pete Buttigieg for shining a spotlight on this issue yesterday with this tweet. We're very excited to see it. Those of you who came in by virtue of seeing this tweet yesterday and maybe finding your way to our webinar, we're glad you're here. And I do want to also recognize Emiko Atherton, who used to be the director of the National Complete Streets Coalition for many years and really helped guide and shape what this report is now, and especially the ways that we have started to focus deeply on issues of equity and inclusiveness on our streets, and in some ways seeing this tweet from the Secretary of Transportation as kind of a culmination of a lot of those years of hard work. So so we're very thankful for that. Just real quick, we'll dive deep into the findings, but at a very high level, just want to say real quick, the numbers that we use in Dangerous by Design, they come from 2010 to 2019. It's data that is gathered by states, but then processed and released by the feds, and it takes a bit of time. So the data in this report goes through the very, very end of 2019, but it takes the federal government oftentimes as much as a year. It took longer this year than it does in typical years. Usually we get it at the end of the next year, and it took a little longer this year, but that's when the data goes through, so that's what we're looking at. We are going to talk briefly about 2020 in just a minute. But over this decade-long period, there was a 47% increase in the number of people struck and killed while walking. It's an astonishing rise over a decade. It's more than 53,000 people, and in this most recent year of data, it's 17 people a day somewhere all across the country are being struck and being killed. This is a trend that is not isolated to certain parts of the country, certain states, certain metros. Almost everywhere in the country got significantly worse over this decade. Some definitely more so than others. We'll get into that, but 49 of 50 states were worse in this report than our last report in 2019, which covers another 10-year period of data running up through 2017. 84 of the 100 largest metro areas are worse since that last report. We are going in the wrong direction on this issue. We'll get much more into the findings later, but I want to introduce Beth Osborne, who is our director of, our Vice President of Transportation at Smart Growth America. Some of you may also know her as the director of our Transportation for America program, and she's going to talk real briefly about what we know so far about what happened in a very unique 2020. So take it away, Beth.
Yeah, thanks, Steve. And as Steve said, it will be a little while before we have all the rich data available from 2020, but there is some data available now thanks to the National Safety Council. Before I get into that, I do want to say that there is a unspoken belief that as people drive more, that there will be more fatalities, and as people drive less, there will be fewer fatalities. And so there's something in there that makes the fatalities sound inevitable as driving goes up, which is why a lot of policymakers want to focus on the rate rather than the raw numbers. Well, what 2020 did was show us that our assumptions are wrong. According to the National Safety Council, for the first time since 2007, preliminary data show that as many as 42,060 people died in motor vehicle crashes in 2020. That marks an 8% increase over 2019 in a year where people drove 13% less because of the pandemic. The preliminary estimates show a rate of death on the roads that spiked 24%, the highest estimated year-over-year jump that the NSC has calculated since 1924. It underscores the nation's persistent failure to prioritize safety on our roadways, which became emptier and therefore far more deadly. Our roadway design encourages speed, but it seems that traffic congestion is one of the only effective current interventions we use for slowing down traffic. And still, getting rid of traffic congestion is the highest priority for most transportation agencies. I'm going to hand things over to my colleague Rayla Bellis, who's going to talk about what we have found in terms of how roadway design creates this danger for those inside and outside of a vehicle. Rayla.
Thank you, Beth. As Beth said, my name's Rayla Bellis. I am the author of this edition of Dangerous by Design. I'm going to walk briefly, hopefully, through some of our key findings from this edition. You can, of course, also see these findings in the report itself and on our website where we house this Dangerous by Design report. Before I do that, though, I'm going to say a few quick words about our methodology, particularly how exactly we do our rankings. So we analyze these trends in pedestrian fatalities in several ways in this report, including one that Steve already mentioned, the total number of people struck and killed each year nationally and how that's trending. For our rankings, though, we use a metric called the Pedestrian Danger Index, or PDI, which allows for a more balanced comparison across different geographic areas and, in some cases, demographics. By putting the raw number of fatalities, the raw number of people struck and killed while walking in the context of an area's population and walking rates. So, for example, in a city like New York City, their fatality numbers are very high, but they also, of course, have a very large population and especially high walking rates. So the Pedestrian Danger Index metric allows us to do a more balanced comparison between a city like New York versus a city like Orlando that has also relatively high numbers of people struck and killed, much smaller than New York City though, but much lower walking rates, meaning that if you're a person walking in Orlando, your relative danger is higher. These data come from the FARS Fatality Analysis Reporting System, which is federal data, as well as the census. Next slide. I'm going to walk briefly through our rankings. So this is our top 20 most dangerous metro areas as of this edition of the report for people walking. Again, this is using our PDI, pedestrian danger index metric, which means that it accounts not just for the number of people struck and killed, but the walking rate and population as well. That being said, just because these are our top 20 most dangerous places, that doesn't mean that anywhere that didn't make this list is doing especially well. As Steve said moments ago, the vast majority of the metro areas have gotten more dangerous since our last edition of this report. In terms of what we see with these top 20 metro areas, though, if you've followed this report in the past, the patterns you're seeing are similar. 17 of these most dangerous metro areas are in southern states. 9 are in Florida, and this list of top 20 most dangerous metro areas, 16 of them were also within our top 20 in the last report. So we haven't seen a ton of movement. Next slide. And we don't just look at where the most dangerous places for people walking are and traveling actively. We also look at how PDI scores change over time. In other words, which places have gotten much more dangerous since our last edition of this report. Like Steve said, these reports cover 10-year periods in terms of fatalities. So these 10 metro areas saw the biggest increases in their pedestrian danger index scores over this time period, comparing our current edition of the report to the last edition of the report. One thing that you can see here is that a number of these places that saw a big increase in their overall danger also overlap with the top 20 most dangerous places, what we saw on the previous slide. So basically, some of the places that are getting more dangerous are in our top 20 list already. On the other hand, several of our top 20 most dangerous MSAs actually saw the largest drops in their PDI scores. So most metro areas got more dangerous, a few got less dangerous. Some of those are still in the top 20 most dangerous list, but they are Orlando, Lakeland, Winter Haven, Jacksonville, and Cape Coral, Fort Myers in Florida. Didn't see their scores drop enough to remove them from this top 20 ranking, but saw some improvement since our last report. Next slide. These are state rankings. Again, as Steve said, 49 out of 50 states got more dangerous since the last edition of this report. And again, here you see very similar patterns. Southern states are heavily represented on this list. On the right side of this slide, you can see a comparison with the top 10 most dangerous from our last edition of this report. Its total overlap, though some of the rankings have changed, the top 10 most dangerous states are the same as they were as of our 2019 report. Next slide. And again, these are the states that saw the biggest increases in their PDI scores since our last report. Once again, some significant overlap between these and the states that are topping the list of most dangerous. Next slide. As Steve said, like our previous edition of this report, we analyzed the most vulnerable groups, who's at greatest risk, who's overrepresented in these tragic deaths. This is an example where the disparities are extremely stark. Black or African American and American Indian or Alaska Native people walking are at relatively much higher danger than other races and ethnicities. Next slide. We also look at this by income level and age. Income level, you can see there's a very clear trend here. Neighborhoods that are lower income, lower median household income are much more heavily represented among these deaths. Older adults are also more heavily represented. Next slide. We added one new piece to our analysis this year. We wanted to assess whether there were disparities between urban and rural areas in who's most represented in these deaths. We can't readily do a PDI, pedestrian danger index, comparison between urban and rural areas based on which national data are available, but we can look by population, and we found that actually the fatality per population are very similar. In rural areas, there's 1.7 deaths per 100,000 people, and in urban areas, that's 1.6 deaths per 100,000 people. So I think this speaks to the fact that these tragedies, this is not just an urban issue. People are absolutely walking in rural areas, and the streets in these communities are often especially dangerous, high speeds, often no sidewalks, no places to cross, not really an expectation that people will be walking. So we need rural solutions as well as solutions for other communities. And with that, I am going to introduce Ken Rose with the Centers for Disease Control and Prevention, one of our report sponsors. As Steve said, Ken is the acting chief for the Physical Activity and Health Branch in CDC's Division of Nutrition, Physical Activity and Obesity. He's also the director of the Active People Healthy Nation initiative. Active People Healthy Nation is a national initiative led by the CDC to help 27 million Americans become more physically active by 2027. And I will turn things over to Ken to tell you more.
Great, thanks so much. Can you hear me? Good, thank you. Well, so greetings and thank you to Smart Growth America for inviting me to make remarks today. My name's Ken Rose, as Rayla said, and I am representing Active People Healthy Nation. It's CDC's initiative to increase physical activity in the nation. Active People Healthy Nation supports Smart Growth America to provide technical assistance to our funded recipients in the field, and we also provided support for the data analysis and research synthesis in this report. Before I start, let me just say that the findings and conclusions in this presentation are mine alone and do not necessarily represent the official position of the U.S. Centers for Disease Control and Prevention. This report clearly shows disproportionate danger and death, thank you, that people of color suffer while walking on our nation's streets. And it further highlights the systemic racial inequities experienced by people of color every day. And we cannot forget that these data represent the unbearable tragedies of loved ones killed just trying to walk to get somewhere. And the problem is only getting worse. Hidden in these terrible data are the added health and quality of life costs associated with inadequate physical activity. Physical activity is one of the best things you can do to protect your health today, tomorrow, and 10 years from now. It can improve academic performance in kids and reduce immediate symptoms of anxiety. In adults, it can immediately improve quality of sleep and reduce blood pressure and symptoms of anxiety. And in older adults, it reduces cognitive decline and falls. So going out for a walk today is truly one of the best things that you can do for your health. In addition, the nation could save $117 billion a year in healthcare costs if everyone met federal recommendations for aerobic physical activity. It's also important to note that walking is an important way people get the physical activity they need. The Physical Activity Guidelines for Americans, second edition, recommends that adults get 150 minutes a week of aerobic physical activity. Data that our scientists analyzed from the National Health Interview Survey showed that at least 3 in 4 adults who meet these recommended levels walked for leisure or transportation. The Surgeon General recognized the importance of walking with the 2015 release of Step It Up, the Surgeon General's call to action to promote walking and walkable communities. Next slide. However, the data we have collected on walking show that people don't have access to safe streets and that dangerous streets pose significant barriers for people who want to walk. Our scientists supporting Active People published national data that showed that only 1 in 3 people reported that they had access to streets that make walking safe and easy. And an even smaller amount, 1 in 7, reported that they had access to streets that make walking safe and easy and locations that offer opportunities to walk like parks. Next slide. In addition to access, people live in places where people driving don't follow posted speed limits. Data published by our scientists collected in another national sample showed that 1/3 of people reported that they lived in neighborhoods where drivers only a third of people reported that they lived in neighborhoods where drivers followed the speed limit. Next slide. And I'm sure it's no surprise to this audience that traffic prevents kids from walking to school. When we asked parents in a 2017 national survey whether their children walked to school, few indicated that they did. In fact, only 16% of these parents, or about 1 in 7, reported that their kids walked to school. And one of the primary barriers that they reported was that walking to school was too dangerous because of traffic. Next slide. And to round out our research in this area, we found that people want safer streets. In another survey we supported, we wanted to see whether people supported investments in safer streets, even if it made driving slower. And in this national sample, over 80% of people reported that they either favored or strongly favored safer street design, even if driving is slower. Next slide. So to summarize the data in these various surveys, roughly a third of people don't have access to safe streets. 2/3 live in neighborhoods where people don't follow speed limits. Almost half reported that traffic made it too unsafe for their kids to walk to school. And over 80% supported safer streets, even if it slowed traffic. If you're interested in learning more about what we found in these various surveys, please see the chat for the references. There's much more detail in each of these academic publications. Active People Healthy Nation supports, if you could go back one, please. Active People Healthy Nation supports improvements to the built environment through a strategy we call activity-friendly routes to everyday destinations. Through this work, we hope to support safer and more convenient places for people to walk, and it's why Smart Growth America has been a partner with us in our work to build this national movement. Shown here is an infographic on our Active People website with examples of activity-friendly routes to everyday destinations. CDC funds health departments, community organizations, cooperative extension service, and national organizations, including Smart Growth America, to implement the strategy. Next slide. Our goal is to get 27 million people more physically active by 2027. We will never reach this goal if we don't address the increase in pedestrian fatalities and the underlying inequities described in Dangerous by Design. As Secretary Pete Buttigieg said yesterday, it's time we invest in safer, more equitable streets. Next slide. The Active People Healthy Nation Initiative is grateful to have been able to support this report. Please consider joining today to stay in touch and support this movement. You can join as an individual influencer in your community, as a professional working for an organization, or as a community champion who is a locally elected official. Thanks so much for your time today and the opportunity to talk.
Great. Thanks so much, Ken. We appreciate you being here today. Next, we're going to hear from a woman named Latanya Byrd, who lives in Philadelphia. And she's going to share with us a story that we actually recorded in advance, is the way she's going to be here today, but about what happened to her and her family on this road in Philadelphia, Pennsylvania, called Roosevelt Boulevard. This is one of the most dangerous streets, I think, in the country. If you've read Angie Schmidt's terrific book, Right of Way, she has half a chapter about this street. It's an astonishing 12 lanes across. It has more than 700 crashes per year. And I think it's fair to say this street works for almost no one. Not drivers, certainly not people on foot or in a wheelchair or using an assistive device. Just a couple of years ago, it was responsible for 20%, for a fifth of all the traffic deaths in this entire city happened on this one corridor. It was designed for speed, and speed is at the center of the next story that we're going to hear. So I want to turn this over to Latanya and let her share her story.
My niece, Samara Banks, and my 3 nephews were killed on the Roosevelt Boulevard on July 16, 2013. So that one night she was walking home and 2 guys were racing down the Roosevelt Boulevard. They were going so fast that the other drivers who were behind them came to a point where they just saw, they thought it was trash. They thought it was debris. Just, you know, like they just went through, I don't know, maybe a bunch of leaves and they just all went up in the air. And come to find out, it was my niece and the babies. By the time our family got to the scene, the police officers and people were looking around for the kids. And we were just so devastated. Like, how fast were these people going? We seen their clothes, we seen their shoes, we just seen everything in the street. My niece and my nephews, they weren't the only people that died on the Roosevelt Boulevard, and not even the only people that died in that location. People just take it as a norm, you know. You're risking your life if you cross that boulevard. What has happened in the recent years is that many little strip malls have been being built along the Roosevelt Boulevard. And they're just building, you know. When they decided, we were thinking like, okay, when you decided to build the Walmart here, you decided to build, you know, Chick-fil-A, or you decided to build all these different type of department stores, did anyone think about the people who live in that neighborhood? However, everyone's trying to cross, because there's older people that try to cross the boulevard because, let's say they're not driving any longer because they're older. They don't have their license any longer, but they want to get across the street to the pharmacy to get their medication, or get across the street to the supermarket, which is on the opposite side of the road. And they're making it halfway. So it may take 2, maybe 3 lights for them to get all the way across. But sometimes the drivers are not paying attention. You know, like everyone says, it's a flat, open road. And some parts of the road, the speed limit goes from 40, right? You're driving flat and it's 40 miles an hour. Then you're going a little downhill. And at the bottom of the hill is 45. Why? We suffer every day when we don't see my niece and my nephews. You know, Samira is my first niece. She was amazing. 27 years old. You would think that's young, but honestly, it seemed like she lived a full life. She learned how to be a mom early because she lost her mom. For her siblings, it's like they lost a second mom. And she was the life of the party and the family. When you have holidays and you have family gatherings, just imagine, she was the one who would put on the family entertainment. She had all the boys practicing dances and songs, and she had all the girls practicing and dancing all the time. Unfortunately, we haven't had anybody to take over or take her place. You know, they say nobody can do it like she did it. We miss them every day. You know, we knew it was so devastating that we wanted people to know that she did not die in vain. My nephews did not die in vain. And all the people who lost their lives on the Roosevelt Boulevard had not died in vain. No one thinks about anyone else until it happens to their family. And we don't want that to happen to your family. Believe me, you wouldn't want it to happen.
Well, it's really hard to follow that, but like we said at the end, we really want to thank Latanya for sharing her story. And I think it's really important to remember that these decisions we make have real and profound impacts on real human lives and the lives of their family. And often what we are trading away is human life in order to save seconds of time to a driver. And that's the purpose of the report, is to revisit this. The deal is, we often look at the actions we have to take to preserve safety as interfering with the convenience of the driver who might want to travel faster, might need to travel faster because we put the things they need so far away from them. We try to make it up for them, that their trip is inconvenient by allowing them to go too fast in the area they are in. But when people are traveling very, very quickly, we lose a lot. The focus on vehicular speed and driver convenience is so strong that even safety is often viewed through that lens. We make room for drivers to make mistakes rather than to avoid those mistakes through design. We weigh the safety of those outside of the car against the convenience of the driver in saving a little bit of time, as if those two objectives are symmetrical. Pedestrian convenience is never thought of at all. And let's look at some examples about how this plays out in the design of roadways. So one, a lot of times we think posting a speed limit has a big impact. Speed is the #1 factor in fatalities. When you're going faster, you have a narrower field of vision. You can't see your peripheral as well because of the speed. You have less time to react to a conflict that you might see ahead of you. And it takes more time to brake when a car is going fast. If you do crash, the likelihood that that will result in a fatality is much higher. So speed has a huge role to play in whether or not crashes occur and whether or not they are fatal. But they are just part of the story. I remember a highway in Virginia where the speed limit changed 4 or 5 times as I was going down it, but the roadway design stayed exactly the same. If they had narrowed the lanes or added medians like you see in this picture, people would have naturally slowed down. As it was wide and people were following the field, not the speed limit. And as someone who's been trained in defensive driving, I knew it was unsafe for me to slow down too much compared to them. So it's more than just the speed limit that impacts how people drive. It's the visual cues to slow down that affects their behavior. So let's look at some of those cues. Streets with wide lanes allow room for mistakes in that if the driver, while driving very quickly, loses control of the vehicle, they can regain control and not leave their lane. So you make the lane much wider than the car so they can swerve. Even if you post a lower speed limit, the very width of the lane, the very width of the road and buildings being set back communicates to the driver that this is like a highway and you can go fast. However, if you narrow down those travel lanes, people naturally slow down regardless of the posted limits. You can also, as in this picture, add medians, add trees. All of this makes you feel snug. And all of us, when we've driven, know we naturally slow down when we feel like we have less room to maneuver. That's an automatic and instinctual response. Another example is of valuing speed over safety. It's just the lack of facilities for pedestrians. Many streets lack just those basic safety essentials like curb ramps or high visibility crosswalks. They have wide corners to prioritize cars turning without having to slow down. They create long crossing distances, which put people in harm's way. Pedestrian safety and travel is not part of the roadway design at all. If it is, it's kind of tacked on. That's why you'll see those intersections with only 3 crosswalks, requiring the pedestrian to cross 3 times to cross once. That priority on speed actually causes inconvenience to the driver too. You'll notice on those roadways that have no left-hand turn all the way down the road, that's because the only driver we really care about is the one who will never turn off the road. So often you'll find yourself having to turn right 3 times to turn left once. But if you build in these high visibility signalized crosswalks, it makes the driver more aware of where the pedestrians are. The pedestrian doesn't have to travel far out of their way in order to make that crossing. And they are also just, they know where to be, and that can provide a lot of safety and comfort in and of itself. And moving on, long distances between intersections also encourage higher speeds. When the road is wide and straight and there's no reason to slow down for a while, you're looking straight ahead, and you're probably looking at the next light that you can see to figure out if you can game it, to figure out if you can get through it more quickly. As a pedestrian, you know the drivers aren't looking for you. It feels pretty hostile. And we do this because adding a crossing adds 30 to 60 seconds of delay to the driver, which we in transportation consider to be a huge problem. The pedestrian, however, may have to walk a half a mile out of their way just to cross the street. That's not considered an issue at all. It's a perfectly reasonable request, even for a child, a mobility impaired person, or a parent with children and grocery bags. To justify a crossing, we expect a certain number of people to violate the law and even get killed by running out in the street to show that there's demand. But you can see here, if there's more frequent need to stop, people are naturally going to go slower. They can't gain as much speed when they're having to slow down and look out regularly. And again, as the driver, they know where to look now for people, because they see where the space is for people, and the pedestrian or the person in a wheelchair or on a bike knows where their crossing is as well. Now going forward, slip lanes, one of my absolute favorite designs. These right-hand slip lanes were designed to avoid cars having to wait for someone turning right at the light. So we let them slip through the right in a lane that is designed to tell the driver you can turn without slowing down. But then we also tell the driver you need to be able to stop on a dime if anyone's in the crosswalk. Now, why would we put a crosswalk in the middle of the lane designed to keep cars moving fast? Because the purpose is to avoid drivers having to pause or stop when they turn. The crosswalk is performative, to say we've provided facilities for the pedestrians. Now, I remember walking through one of these when my daughter was young and in a stroller. I would back out into the intersection, and once I was in the middle, I'd swing the stroller around to the other side, figuring if someone got hit, it probably should be me, but maybe I would provide slightly more visibility, because I knew drivers could not see me. If you go on to the next slide, you'll see a GIF that really gets at this issue, that the driver is being told simultaneously, don't slow down, but stop in an instant if there's a person. This is not possible just due to physics and the weight of the vehicle. But when something inevitably goes wrong, we just say it was driver error and the driver's fault. And this is, again, done in order to save drivers fewer than 5 seconds per car. We do not project or consider potential loss of life due to a potential conflict or a crash. If you go back to Roosevelt Boulevard in Philadelphia, this is a huge, wide street with all of those speed over safety characteristics. The road is wide, it's straight, there are a few intersections, there are a few reasons to stop along the way. And all of this reminds me of an article, an academic article I recently read called Towards Safe Systems, Traffic Safety, Cognition, and the Built Environment, which found that drivers do not make choices through conscious intentional decisions, but instead through the influence of expected behavior based on roadway type, which means design. The report explains that the design of the built environment primes drivers' expectations about potential conflicts or hazards and to what risks they should be prepared to respond to. The embedded conditions in the built environment can cause attentional blindness. Basically means you're not attentive to things that are there. You can look and still not see a conflict type that the design does not prepare you to watch out for. So a roadway like this that is wide and the development set back and it's straight and there's not a lot of reasons to stop, the driver won't expect to see pedestrians and they won't see them. But if a road is narrow and flanked by Main Street style development, people are more likely to drive slowly, even if the speed limit is higher, and expect pedestrians. And at this point, I'm going to hand things over to Steve to show another example of how this design makes things incredibly inconvenient for a lot of the people using it, because they're not the people we think about when we design the roads.
Yeah, that's great. Thanks, Beth. We're going to be joined here by Dr. Scott Crawford and Gladys Bunzy, who will tell you about themselves in their own words. Again, we've got a slightly longer video here that shows a real ground level view of what it's like to depend on a system that in the end is just not made for you if you're not in a car. So here we go.
My name is Scott M. Crawford. I'm a retired clinical neuropsychologist. I came down with multiple sclerosis in 1999 and had to retire. I now use a power wheelchair for mobility. Since my retirement, I have rededicated my life towards ending this disease, multiple sclerosis, and also creating more welcoming society for people of all abilities, advocating for the needs of people with disabilities.
My name is Gladys Bunzy. I am the president for the Fixed Route Committee for JTRAN in Jackson, Mississippi. I've been the committee president for over 5 years now. I've been trying to get the transportation department, JTRAN, to become a better service for the city of Jackson.
The presumption is that everybody has their own car and everybody can use their own car for all their trips. And that's just not so. We know this.
I rely on what is called Medicaid waiver, which now, since I've become disabled, one of the services that they offer to me is transportation. By having that transportation, I have to call like maybe 2-3 days ahead of time to schedule a ride to get to where I'm going. And I'm only limited 4 hours per day, and you know, as many days, like 5 days a week or 3 days a week, that I can get the service to, you know, go around, pay bills, make groceries, etc., and take care of my own personal business.
Before Jackson saw the light and started to create more complete streets, it was horrible. It was incredibly stressful. I would have to ride my wheelchair in the street against traffic, knowing that I could lose my life at any time. That's incredibly stressful. Whenever I left the house, it was making a decision. Is this worth risking my life? It's like playing Russian roulette. And so, you know, leaving the house means a decision. Is this trip really worth my life? That's how it feels.
It is extremely hard. But there are no sidewalks. Out here where I live now, or where I'm trying to move to, there are no sidewalks. There are none. And I don't know what they were thinking when they built this city, not to put sidewalks down, but there are no sidewalks. People, if you're walking down the street to where I live now, you have to walk in the ditch on the grass to keep out of traffic. It's quite dangerous either way.
Most of the streets in Jackson remain inaccessible and unsafe for pedestrians of any kind, especially people with disabilities. Most of the streets we have don't have sidewalks at all. The sidewalks we do have are extremely narrow, often obstructed by utility poles. They lack curb ramps, and are in ill repair, so they're not safe for anyone. So a lot of folks have to walk in the street, or they walk in the dirt and mud next to the street, if that's possible. And basically what that communicates to us is your life doesn't matter. Pedestrians don't exist at all here. You know, it feels like society is saying, you don't belong. Get off the street. You're in the way. Or at best, your life is expendable.
It's just a message that I got a car. If you don't have a car, oh well. I mean, I feel like they just don't care.
I-55 frontage roads along 55 North here in Jackson, they have something like 6 lanes going one direction, no sidewalks whatsoever. And the few sidewalks that we have that go under the overpasses, they don't even have curb ramps. They're not usable by anyone with a disability. And those motorists are blind. It's meant to advantage people in their automobiles getting somewhere as fast as possible. And there is no consideration for the safety of pedestrians or people that use transit.
When I was riding the bus before the pandemic hit and slowed the service down, you get put off, depending on where the bus stop is, you get put off in the grass, you get put off on a corner, and most of the time, sometimes the sidewalk or the street is busted up for whatever reason, and you have to step over busted up concrete and things of that nature to, in order just to get to a safe spot so you can safely walk down the street where you got to go.
In my neighborhood, they had to put the road on a road diet. They had to get rid of one lane of traffic, so that they could add a multi-use path and sidewalks and bus stops that are accessible. Through a lot of hard work, some very dedicated people at the City of Jackson wrote and won a very competitive Tiger grant for that funding. Thankfully, we won. And that gave us some of the funding we needed to make this happen. Now, as we have done better and developed some accessible sidewalks on some of our streets, at least in my neighborhood, it's a pleasure to go out. I feel like other pedestrians. I can enjoy the scenery. It's low stress. The quality and independence I have now is massively better than it was.
From my apartment complex, there's a convenience store up the street. There's also Dollar General, etc. In a little shopping area up the street. But on either side is great room for some sidewalks so people can walk.
I've noticed that when I have to ride my wheelchair in the street, being a white male, I get mostly left alone by the police, mostly. One time, I was trying to go to church, and I was on Meadowbrook, and there was one of those sidewalks that is completely useless. I mean, no curb ramps, utility poles. This is not a sidewalk. Okay, but the police officer stops like 100 yards away and blares over the intercom. Why aren't you on the sidewalk? Why aren't you using that sidewalk? People fought hard for that sidewalk. And I'm like, sir, I can't use that sidewalk. It doesn't have any curb ramps. The utility poles are right in the way. I can't use it. My black friends who do the same thing because they have to get harassed a lot more often. So there's the white privilege in action. I know it's 10 times worse for everybody else. People of color.
If we were a priority, if that was their main course, their main focus, their main goal, it would have been done years ago. We're in 2021 and we're struggling with these same street problems. I mean, you have to have a car here in Jackson to get around, to be on the safe side, to put it bluntly.
Well, over the years, I've sent many complaints to the city, to the Federal Highway Administration, to the Mississippi Department of Transportation, Office of Civil Rights, noting that, I had to wait in the street or in the dirt, in the grass for a bus. The buses weren't accessible. We had to win that fight. I think hearts and minds here in the city of Jackson have changed, and they want to do the right thing. We need about $2 billion, with a B, $2 billion here in Jackson to fix all of it. Fix our streets, fix our sewers, fix our water infrastructure so that people have safe water to drink. We need help. That's what we need most.
It's very hard. I mean, but we if you got to go somewhere and you can't pay somebody to get in their car to take you where you need to go, it's very hard. I walk with a cane now, and by me having a stroke 10, 11 years ago, this is the thing, my balance is severely off. They need to be level for a person like me, because now, since I had the stroke, I have to be walking on a level, flat surface to walk on for me to feel safe walking.
We're still fighting that uphill battle that sidewalks, so-called sidewalks, are just a nice luxury, not a necessity. And that's really the attitude that we have to change.
Yet another sobering story, but I think really nicely laid out by our friends in Jackson. So I think the issues we want to finish on are things that can be done. And there's a lot of exciting activity going on here in Washington, D.C. The Complete Streets Act of 2021 has been introduced. It's a bill that sets aside federal funding to support complete streets projects at 5% of the annual federal highway funds. It requires states to create a program to provide technical assistance and award funding for communities to build complete streets projects. And it directs localities to adopt a complete streets policy that meets the minimum set of standards to access that dedicated funding. And it is based on a law that was passed in Massachusetts and has had some real success. Another thing going on right now is an effort to improve a guide called the MUTCD, the Manual of Uniform Traffic Control Devices. It is a document that a lot of people don't know about, but it sets standards that are very hard to get around. And many of those standards are so pro-automobile that it's extremely hard to build the kind of road we know is safe. If you've had an interaction with a standard set in the MUTCD that makes it very difficult to build a road with a good crossing or a safety mechanism to protect people, we invite you to share that story, and you can share it through our website, but also you can go and connect to America Walks as well. You can see here that americawalks.org/share a story is one place you can also share it. We do encourage you, because true stories help people understand what is and isn't working in the manual. And it does sound like U.S. Department of Transportation is interested in revisiting this. And finally, I just want to say that we are expecting the White House to issue an infrastructure package. And traditionally, the way we handle safety is we provide a little pot of safety money to retrofit dangerous roadways, while we spend 10 to 20 times that amount to build new dangerous roads that will then need to be retrofitted. One thing I encourage people to keep your eyes on is whether or not they follow that completely unsuccessful procedure to improve safety, or whether or not all dollars will be spent to create safer roads for all people. And at this point, if you would like to submit some questions, we would like to tackle as many as we can, and I will hand things over to Steve to manage that.
Yeah, thank you, Thank you, Beth. We've gotten a bunch of great questions in. We've obviously got way more than we're going to be able to answer. We're going to try to answer some of these good ones on Twitter. We'll also put them in a post that we'll send out to everybody next week. But let me go to just a couple questions here. One, I want to talk about, Beth, maybe you can answer this, or Rayla, about data. What do we not have? What's missing from this picture? We don't include data on bicyclists, the data on people using assistive devices, wheelchairs, canes, walkers, all of those things is uneven. What do we need to get to have a better picture of what's actually happening for all people with our system?
Rayla, do you want to start out talking about the data you looked for and could not find? And then I'll add to it.
Yeah, let me think. Some of the limitations. So because this comes from crash reports from states, there's certain limitations in terms of what information is collected at that time. So for instance, the data on race and ethnicity is very limited. About 10% of the fatalities don't have any race or ethnicity reported at all. So that's a big limitation. We also know that we tried to actually parse out people traveling with different disabilities for this analysis and had a difficult time doing that and weren't able to because of the way they're grouped with people traveling using things like skateboards and other devices like that. The time lag is a big one too, that's coming up and being a big concern as we think about doing this analysis for 2020. And the fact that our pedestrian danger index uses the way that we normalize for walking is walking trips to work. That's the best option we have nationally to look across different places, but of course there's significant limitations to that, and particularly so as we look at this year that we just saw, where we saw such changes. That's what I was going to focus
on, is we don't count people walking on our roadways, which is why we can't measure the accommodations or the impact on them. They literally are not a part of our roadway design process. If they are, they're tacked on at the end. So we don't know how many people are walking. So to get a sense of your exposure to danger, you have to be able to normalize for the number of people out there, but we have no idea because we don't try to count. And the only thing we've been able to use is walk to work data. Well, a lot less people went into work last year, so we're worried about that. And another point I would make is speed versus speeding. So we track how many speeding related fatalities there are where someone is breaking the speed limit, but we don't measure how many times speed created the circumstances for that fatality, so long as they're going the speed limit. But too many times that speed limit is completely inappropriate. And that's another thing I'd really like to see. So there's a lot.
Great. A question from David Eagleton, which I think really applies across the board for states, MPOs, for cities. He asked, when are MPOs going to be required to fund applications, to only fund applications that design streets for all users? Beth, maybe you'd like to just talk a little bit about the wide latitude that's given to states and metro areas to design their streets, but with the money that they're given by Congress, and what can and should be changed there.
Yeah, I think it's really important to know that in most metropolitan areas, there is a mix of roadway ownership that impacts the walkability. And so it's not just one level that needs to get it right, it's all of them. I will point out the MPOs own none of them. Now they might parse out money, but they don't own any of the roadways. The states, the counties, and localities do. And if you want to have a truly walkable network, all three of those entities need to be designing roadways in developed areas for people both in and out of a car. If you want to build a highway where there won't be people, you create a limited access highway, or you prevent development from happening around it. But once there's development there, you should be forced to accommodate people. When will people be forced to do that? That's a very good question, and that's going to be something that we'll be talking about, at least with federal dollars, as they take up a stimulus bill and put a lot of money on the street, as they take up a reauthorization of our current surface transportation program. But I will point out that that money, those rules will really only apply to money that goes out through the federal government. And federal spending on transportation is only about 1/3 of spending. So we need to think about ways to communicate more clearly to the folks spending the other 2/3 that they have to get the rules right too. And if the feds did set some basic standards that are very safety related, it would certainly help to indicate that that is the appropriate and best procedure in terms of standards. But the task is larger than that.
Great. Well, we've gotten a handful of questions from people about automated enforcement. And what's the role of automated enforcement in this, and also enforcement in general? It gets into some thorny issues with related to equity, but how does automated enforcement fit in when we start talking about designing streets for safety?
It's a really good question, and I'd like to start by saying if we designed our roadways appropriately, enforcement would not be as necessary. So what we tend to do in most areas is create a speed trap. We design the roadway for 50-mile-per-hour traffic, and then we post it for 35. So we tell the driver with the design, go fast, and then every quarter of a mile or so, they see a sign that says you're speeding. And then if we catch you, we'll extract you for money. That is not good governance. So first, let's just build our roadways in a way that is most likely to get the most people to drive the speed we want them to go. And then how you enforce becomes much less of an issue, because people will naturally do what you want them to do, because that's the safest, most comfortable feel for them. Now, in terms of enforcement, there is a role for automated enforcement. I think what the city of New York did was really interesting, where they focused enforcement around schools, all schools across the entire city. So there was an understanding of what they were trying to do. They were trying to create safer atmosphere for kids to walk to school. It was equitable as it applied to every school in every neighborhood in every part of the city, and they learned from that. It was something that people could understand. But I think it's really important to recognize with any kind of enforcement that there's a built-in inequity, that the roadways that are built most for speed are often the ones that go through minority neighborhoods. Again, the enforcement mechanism is a big cheat in that you communicate to people to drive fast and then you punish them for going the speed that you told them to go, and that the penalties can really harm lower income people who were, again, tricked by the design. So I want to start with fixing the design, but I also want to recognize that it's people of color that are bearing the burden of fatalities and the danger, and want to look for ways to protect them. And so there's probably a role for some automated enforcement to save lives. We just need to do it in a very smart and targeted way.
Great. Well, I think we'll finish with this one question. We're just a little over, but we got a question from Ivan about, is the survey result about people preferring housing in, more connected, denser neighborhoods confirmed by real estate demand?
Yeah. In fact, one of the things we hear is if you add a complete street or you add a sidewalk or bike lane, that property values go up. Well, that is the market telling you that that is the thing everybody wants, but there's not a big enough supply for it. And realtors actually list walk score on their listings because they know how in demand safe, walkable neighborhoods are. But the government has said building like that is not permitted or will be very hard. So basically, the government has gone and interfered with the marketplace to keep supply low for something where demand is high. And therefore, the government is artificially raising the price of that very desired object. What we're trying to do is point out, again, how inequitable that is. It means only people with the most money can access the places that are the safest. And this is something we need to undo. It should be ubiquitous. Every neighborhood where people live should be a walkable, safe community. And Ken, I don't know if there's anything you wanted to add to that before we finish, but I did want to give you a chance to.
No, Beth, you did a great job. I just want to thank you for having me. These things are really important, and having equitable access to safe and easy places to be able to walk as essential to promoting health.
Absolutely. Well, that's a great word from Ken to close things out. We got a ton of questions. We'll try to tackle as many as we can in an email that we send out soon to everybody who registered. Whether you made it here or not today, we'll also have links to the citations for the data that Beth mentioned, that Ken mentioned. All those things will be in the email. I want to thank Rayla and Beth, and especially Ken, for your time today. I want to thank Nelson Nygaard Consulting, and also CDC and the Active People Healthy Nation. If you're a member of the media, again, we're available for interviews. Reach out for questions. And I want to give my biggest thanks to Latanya Byrd and to Dr. Scott Crawford and to Miss Gladys Bunzy, for sharing their stories, for their tireless advocacy at the local and state level. All three of you are heroes of mine, and I had a great time talking to you and getting to know you and hearing about your experience. And we wish you the best as you do incredibly important work.
And Steve, I just wanted to invite all the folks on this call, if you have pictures or videos from your community, to please share that with us. And we thank you for your interest and participation today and all that you do to make our streets safer.
That's it. Great. Thanks. We'll see you next time.